The separation of a baby from their mother remains a profoundly significant childhood trauma. NICU babies have a much higher risk for autism, ADHD, behavioral and emotional disorders. And NICU moms often experience PTSD, depression, and anxiety.
I myself am a new NICU mom, and this was a complete and total shock and emotional roller coaster. Anger, hopelessness, and guilt were my initial response to this.
The worst part about it is I didn't know how to help him. I really didn't. I remember having the feeling of, maybe I should just stand back and let doctors and nurses do their job. I didn't want to be in the way. I didn't want to cause more harm, than good.
Right off the bat, the experience is chaotic. It seems kind of unnatural. And I was feeling guilty because I was like, look at the position that she's in right now, and having to have all these things connected all over her face. I couldn't stop thinking about like how uncomfortable she would like be feeling.
Babies in the NICU experience repeated painful procedures and can learn to fear and withdraw from adults. In the absence of normal maternal-infant nurturing behaviors, the emotional connection between mother and baby is interrupted and recorded in the nervous system, creating lasting emotional and behavioral dysfunction. It is a devastating problem, and we've been working on a great solution called family nurture care. UTHealth has implemented this innovative and low-cost intervention in the NICU at University Hospital that serves about 1,000 of the sickest neonates in Bexar and surrounding counties each year. Family nurture care serves to heal the interrupted emotional connection between mother and baby, led by trained nurture specialists. This cultivates a thriving relationship between the mother and baby and impacts the trajectory of their well-being for life.
I believe the nurture care program should be essential in every NICU because I look forward to coming into the NICU every day, and when I am sitting with Jackson, I feel overwhelming joy. It is a reassurance for me that he's okay.
I remember Cheryl and Umber teaching me, empowering me to take my role back as his mom. If I could have one wish in this world, it would be for every NICU mom to have that experience that I did.
I feel like I didn't stop feeling discouraged until I was able to speak to a nurture specialist, and they taught me like what a good bond looks like with a mother and their baby, and they kind of guided me on what I can do to form that bond and to make it stronger. And also expressing to her how happy I am that I'm holding her and that she's okay, and I tell her all the time how strong she is and how perfect she is.
Anytime that parents and children are experiencing hospital care, it can be traumatic for all of them. I'm grateful for the Family Nurture Care program that emphasizes the importance of parents as part of the care team. We can make a difference for families by giving them all the best start possible. This impact continues for many years, long after the family leaves our hospitals.
If we are awarded this high-impact grant, UTHealth can fund family nurture care for its second year, after which the hospital will consider funding the program permanently based on our outcomes data. We're also writing a roadmap so that other NICUs can follow. We've already begun to see the power of this change in the culture of our own unit and in the physicians and nurses trained by UTHealth, who can now take this life-changing paradigm of care out into all of their future practices. Join us in giving mothers and babies at their most vulnerable point a life of hope and health.